So today's video is a follow-up on a series we're having on prostate health and disease. So in today's video, we're going to be looking at what an elevated PSA level could mean, some of the things that increases your risk or predisposes you to developing a prostate cancer, and lastly, we're going to look at the importance of routine screening. Now, if you've not seen the pattern of the video, right, I'll advise you go check that out first so you have a comprehensive understanding or comprehensive overview on the topic of prostate health and disease. So let's begin by looking at what a PSA means. Now, if you can recall from the last video, we said PSA stands for prostate specific antigen. Now, this PSA is a protein that's produced by your prostate glands. And then, so it's not unusual to find it in your blood. But however, when the levels are abnormally elevated, then your doctor becomes worried and they want to evaluate to further determine what is actually causing this increase in your PSA level. So to the close of the matter, your lab result is out and your doctor is saying your PSA level is elevated. Does this translate that you have cancer into you having cancer? The accurate answer is no. There are quite a number of things that could cause your PSA level to be elevated without it necessarily being cancer. So the first on my list is what we call a benign prostatic hyperplasia or benign prostatic enlargement. You hear things like people say, oh, BPH. That's benign prostatic enlargement. Now, when we say something is benign in medicine, we just say means oh, it's not cancerous. This one does not have cancer. It's not malignant or is harmless. So it's possible for your prostate gland to be enlarged without it being as a result of cancer. These two can cause your PSA levels to be elevated. Second on my list is what we call prostatitis. This just means an infection or an inflammation of the prostate gland. Don't forget that we said the prostate is actually what produces this PSA. So by the time there's an infection or an inflammation of the prostate gland, the prostate is stimulated and it can now cause the prostate to increase the production of the PSA level. But usually this is going to be a temporary rise in your PSA level. Third on my list is a urinary tract infection, especially a urinary tract infection that's affecting your lower urinary tract. Now, don't forget that during the last video, we said that one of the things your doctor is going to send for, one of the investigations your doctor will request for you to do is what we call a urine test or urinalysis rather. Now, this is to rule out the possibility of an infection that is causing some of the symptoms you're experiencing or even the elevated levels of PSA in the first place. Fourth on my list is a recent pelvic stimulation. So, like we said during the course of the last video, one of the things that your doctor will do for you is what we call a DRE. That's a digital rectal examination. Now, in doing this examination, the doctor will have to manually put their hands and feel for your prostate to check if it's enlarged. Now, this palpation and feeling can actually stimulate the prostate and cause it to increase the production of PSA. But this increase in PSA level is also going to be very temporal and is expected to drop to normal levels within few hours. Another thing too that can cause your PSA levels to be temporarily elevated without it necessarily being cancerous is recent ejaculation and recent sexual activities. Now, however, with recent ejaculation or recent sexual activity, it's expected that your PSA levels will fall to normal within 48 hours of the sexual exposure. Now, apart from that, another thing too that could cause your PSA levels to be elevated is things like urological procedures. So somebody just had a catheter passed. Now, during the passage of the catheter, there's a possibility that your prostate gland was stimulated, and this too can now cause the prostate gland to increase the level of PSA temporarily. So this can actually cause your PSA levels to be temporarily elevated. Now, don't forget I keep using the word temporary. Most of these things will cause temporary increase in your PSA levels. Now, last but not the least, last on my list is aging. It's been found that PSA levels tend to increase naturally as men grow older. So that's why it's very important for the doctor to correlate the PSA levels we're having to the age of the patient. Now that we've looked about or talked about some of those things that could cause your PSA levels to be elevated without necessarily being cancerous. Now let's talk about some of the risk factors that could increase, put you at an increased risk for developing a prostate cancer. Now the first on my list is age. Since we found that with increased age comes an increased risk for developing prostate cancer. So it's been found that from age 50, your risk of developing prostate cancer is increased. But however, it can also be found in people that are less than 40 years of age, but on very, very rare occasions. Now, about 60% of prostate cancer cases have been found in men that are over 65 years of age. Now, the second on my list is race or ethnicity. So it's been found that black men, especially men of African descent or African American descent, have been found to have an increased risk of developing prostate cancer. Also, black men also have been found to have develop prostate cancer at a much younger age. And lastly, it's also been found that in black men, for some strange reasons, they tend to develop a more aggressive form of prostate cancer. Now, the third thing on my list with regards to risk factors for developing prostate cancer is the family history and genetics. Now, if you have a father that has prostate cancer, your brother has prostate cancer, or you even have a son that has prostate cancer, then your own risk of developing prostate cancer is doubled. Now, this doubled risk even becomes further increased if multiple members of your family have prostate cancer. Take, for instance, your father has prostate cancer, your brother also has prostate cancer, then your risk of developing prostate cancer is tripled, is further increased. Now, apart from that, the risk is also further increased when you have a member of your family that developed prostate cancer at a much younger age. So if you have a member of your family that developed prostate cancer, say at age 35, then your own risk of developing prostate cancer is much more increased. Now, this prostate cancer has been found genetically to run in families where we have a mutation of what we call a BRCA1 and a BRCA2 gene. Now, this gene has also been found in people that have some form of breast cancer, so to speak. So apart from that, another risk factor for developing prostate cancer is diet and lifestyle. So it's been found that very high fatty meals and red meat may slightly increase your risk of developing prostate cancer. So you want to take those things in moderation. Now, apart from that, it's also been found, studies have shown that diets that are low in fruits and vegetables can also increase your risk of developing prostate cancer. Obesity too is one of the things that has been linked to a more aggressive form of prostate cancer. Now, still on lifestyle, one of the things too that usually when we say cancer of any form that we want to mention, number one is smoking. Smoking too has been linked to an increased risk of developing prostate cancer. So another thing that increases your risk of developing prostate cancer is lack of physical activity. So lack of physical activity has been found to increase your risk for developing things such as obesity and hormonal imbalance, which are also linked to developing prostate cancer. And also, it's also important for us to know that men that are very active tend to have lower levels of PSA, and then this possibly could translate into lower risk of developing a prostate cancer. Now, apart from that, last on my list is hormones. So it's been found that hormones, that's the androgen testosterone, now tends to fuel the growth of prostate cancer. And as such, it's quite advisable that for every man on hormonal replacement therapy or testosterone, as the case may be, should be regularly monitored with regards to screening for prostate cancer, because this hormones actually fuels the growth of prostate cancer. So now that we have seen some of the risk factors for developing prostate cancer, when then should we start screening? Is screening important in the first place? When then should we start screening? Now, it's usually advisable for men to start screening, especially when you don't have any risk factors or their risk is low, to start screening from age 50. But however, if you're someone that has you're at a higher risk of developing prostate cancer, say for instance you're black, so you have a family history of prostate cancer, or somebody in your family had prostate cancer at a much younger age, then you might need to start screening for prostate cancer at a more younger age, say from age 40. But it's best you visit your doctor who will now look at your risk, assess your risk for developing prostate cancer, and now develop a screening plan that is well suited for you. Now, in our next video, we're going to be looking at some of the complications that could arise from when you ignore prostate problems, and then how you can actually maintain some of the things you could do to maintain your prostate health in general. Don't forget, this series is on prostate health and disease. So I feel like we've dwelt a lot on the disease part. So let's look at, in the next video, we're going to be talking about how we can improve our health, our prostate health in general. I'll see you in the next video.